Hello, my name's Alex Schadenberg. I'm the Executive Director of the Euthanasia Prevention Coalition. Now that Canada has legalized Bill C7, what do we do now? This is a big issue for Canadians who believe in the cause of life. Well, Canada passed Bill C7 on March 17th, 2021, not so long ago. And that expanded the law, even though the government did not do the 5-year review that was required by them by the original legislation, Bill C14, which had passed in June of 2016. The expansion of Canada's euthanasia law was supposedly based on the Quebec Truchon court decision, but in fact, Bill C7 went much further than the Quebec decision. Now, the Quebec decision should have been appealed, but of course, it wasn't appealed. The fact is, Bill C7 removed several things. It changed several things in the law. It removed the requirement of the law that someone's natural death be reasonably foreseeable. That was the quote terminal illness requirement in the law. Bill C7 permitted medical practitioners to lethally inject a person who is incompetent if they had been previously approved for euthanasia. Bill C7 created a two-track law. So what happens is if someone is deemed that their death is reasonably foreseeable, meaning that they will die within a reasonably near period of time, they can have an instant death. They can die the same day, no waiting period. Whereas those whose deaths are not deemed reasonably foreseeable, they will have a 90-day waiting period. I predict that this will go to court. I predict that this is an inequality within the law that will be struck down by future court decisions. Bill C7 approved euthanasia for people with mental illness alone. Now they're holding on to that for 2 years in order to develop the protocols around killing. According to the Office of the Chief Coroner of Ontario, has been 6,696 euthanasia deaths in Ontario as of December 31st, 2020. Okay, the numbers have obviously grown greatly since then. 6,694 were euthanasia, 2 were assisted suicide. So almost all of them are euthanasia deaths. And the number increased by 33% in 2020 over 2019. There have been 2,378 reported assisted deaths in 2020. There were 1,789 in 2019. The Canadian reports have been really delayed. So when you look at the Canadian data, it's all delayed. The most recent numbers we have for the Canadian data is 13,946 as of December 31st, 2019. When you look at the data and the 33% increase in Ontario alone in 2020, I predict that there was around 7,500 assisted deaths in 2020 in Canada, bringing us way past 21,000 in Canada alone. When Canada legalized euthanasia and assisted suicide in 2016, they required a 5-year review of the law to be done in June of 2020, to be started in June of 2020. It has not occurred. Recently, the government established a review committee that's based on 10 members of parliament and 5 senators. Now, we understand that the government's going to skew this towards expanding the law further because they've sort of made that sort of clear. We, though, believe that this is an opportunity for Canadians to be involved with challenging this current law. We also have good things on the horizon that we can deal with. Bill C-268 was sponsored by Kelly Block. She's a member of parliament from Saskatchewan. It's to protect medical conscience rights, medical professionals' conscience rights. We have a serious problem with conscience rights in Canada, especially in Ontario. In Ontario, the College of Physicians and Surgeons requires physicians to do what they call an effective referral, meaning doctors and nurses don't have to kill their patients, but they have to refer them to someone who will, which means they're requiring them to participate in the act. COVID-19 protocols are also creating further issues around conscience rights in Ontario. There's been further trampling on conscience rights when we look at the Delta Hospice Society. On February 24th, 2021, the Delta Hospice Society's funding was ceased. Their building that they had, their hospice building, their 10-bed hospice, was expropriated from them by the provincial government in BC, all because they refused to kill their patients. Most hospices want nothing to do with euthanasia, and yet because of the pressure and the fact that the Delta Hospice Society was made an example of, they're being pressured into participating into euthanasia. Very few people, though, ask for an assisted death based on physical pain. When we look at the data, very, very few people are asking for it for those reasons. Most people ask for an assisted death because they're experiencing difficult life-limiting diseases or conditions. They feel that their life lacks purpose, value, meaning, and hope. They feel that no one cares about them and they fear being a burden on others. They fear possible future suffering. These are normal human feelings. And when a person is lonely and depressed and socially isolated and feeling abandoned, their lives are threatened. by euthanasia. We live in a culture of loneliness and isolation and social abandonment. The factors that are driving people to consider suicide or to seek an assisted death are being normalized within our culture. There are more people today who live alone, lack significant community, feel hopeless, or feel that they have no reason to live than ever before. Now that euthanasia has been legalized, people are seeking death for by euthanasia as a death of despair, a way to get out. But these are dealing with normal human realities. Euthanasia threatens all of our lives, but we can make a difference in the lives of others. We can help others. We can help protect people from euthanasia. The Compassionate Community Care Charity was set up to do exactly this, to help people who experience difficult health conditions, and has created a training program for people to be with others who have loneliness and isolation, to visit others. Of course, visiting is now nearly impossible during the COVID pandemic, but nearly in the future, there'll be an opportunity. But have you phoned someone today? Have you phoned an elderly person who you know who's been shut in? Have you talked to people who are vulnerable and lonely? CCC Volunteer Program provides the tools to call, to visit, and to be with others. We can protect others by caring for them because we are all affected by the legalization of euthanasia because we are human. We all experience similar human emotions and feelings. Cultural loneliness affects our health, it affects our quality of life, it is a threat to our life. Groups and individuals can organize a compassionate community care training session to create a renewed effort to be with and care for those who we love and who we know. And that's done by contacting Compassionate Community Care at info@beingwith.org. The Euthanasia Prevention Coalition is a nonprofit corporation that requires you to become a member for us to be effective. Become a member of the Euthanasia Prevention Coalition. Thank you very much.